Hi, now we're going to continue what is biomedical engineering by examples. So now this time we will discuss about biomolecular engineering. So what is biomolecular engineering? So this is coming from using chemical engineering principles for design and analysis of drug delivery system or tissue or cellular level engineering. So interaction of medical implants and the body or biomaterials design and drug delivery system and so-called nanotechnology plus biotechnology. So nanobiotechnology is an example. So I'm going to introduce a discipline called tissue engineering, which belongs to related to biomolecular engineering. So the use of cells and biomaterials and biochemical factors to improve or replace biological tissue is called tissue engineering. Let's think about an example. So for example, artificial skin. How to create artificial skin if a patient has a burn injury and some part of the tissue or skin has to be replaced or regenerated, then maybe for the time being, we can create artificial skin, so which can protect the skin from infection and help regeneration and wound healing. So to create this, let's see one example. So we need a raw material. So the tissue is composed of cells, so cell and biomaterial and scaffold. Scaffold is a temporary supporting structure, usually used in construction site. So in tissue engineering, we can also use this kind of a scaffold, which supports the cells and can create microenvironment. So scaffold plus cells. And to be able to make it more relevant, we need to also consider environmental factors. So this includes cytokines, growth factors, genetic manipulation, mechanical forces, and physical-chemical factors, spatial and temporal signals, and extracellular matrix molecules, and cell surface molecules. So these factors intricately interact and create an environment which is happening in our body as a tissue. So these can create an engineered tissue so that we can create a tissue substitute. So here I talk about cytokines, and let me explain you what cytokine means. Cyto means cells and kine means movement. So this is a small immunomodulating agent or proteins that are secreted by immune system and have an effect on other cells. So these a bunch of factors we can control and provide environmental factor, and we can create tissue substrate. So how close we are from this artificial skin? I would say we probably cannot totally replace. So, but we can help promote repair and regeneration process of the tissue. So we call this as a tissue engineering construct. So the second example of biomolecular engineering, and I brought a picture from Wikipedia. This, like this Y-shaped tissue, is in fact a carotid artery. So everyone has, the heart sends out blood to through this artery. So there's a common carotid artery. One is going inside the skull, which is internal carotid artery. The other is outside of the skull, which includes the face. So this is an external carotid artery. And this is a site where atherosclerotic plaque can be formed very easily. So when you are having a health checkup, you could have ultrasound which measures this carotid artery, and then it actually sees if there's a plaque there, and that's a sign of problems because it can create the fluid, and this blood flow, it can interfere it. So it creates not laminar flow, but turbulent flow can occur. And sometimes doctors are using stethoscope or other technique can actually detect this. So this is an example of common carotid artery, and one of these is internal and external carotid artery. So you can see there is a lesion over here. So this is an atherosclerotic plaque, and from a carotid endoarterectomy specimen. This sounds a little bit difficult, but this endo means endothelium, which means the lining of inside of blood vessel, and arterectomy means by cutting off, peeling off this endothelium to remove the plaque. So this is from the surgical specimen. And this is a problematic because you can see this part, if the tissue underneath the endothelial cells is exposed, then our body has a clotting mechanism to protect blood from leaking out of the our circulatory system. So that blood clot can form, we call it as a thrombus. And this thrombus can travel down, which we call an embolus. So this embolus can go directly into the brain. It can lodge in a vessel that can cause ischemic stroke. So this could be a big problem. And now I talk about plaque. Let me define what is plaque. And you can see from this picture, plaque sometimes means a word ornament which we attach on the wall, such as this word. But in medicine, it's kind of attaching way, so it's similar, but we call plaque as a small patch resulting from local damage or deposition of material, such as this. Or when you go to dental clinic, they call a dental plaque, which is deposition, which is on our teeth. So in heart, plaque is very important. So this plaque in heart, especially the blood vessel which feeds our heart, can have plaque if we have underlying disease process. This plaque can rupture and cause myocardial infarction. So plaque meaning to stick, and let's see how it looks like. So this is an artery, and this is an illustration of how plaque can interfere with the blood flow. So you can see that when the plaque grows, then that can interfere flow. And in engineering point of view, this diameter is related to resistance of the flow. So this narrowed arterial blood vessel is due to this atheroma. And this atheroma enlarges the arterial wall, can rupture, and it can release blood clots that lead to narrowing of the artery, sometimes complete closure of the lumen. Think about this happens in your heart and the feeding vessel to your heart muscle, then this blockage can cause a death of the heart tissue, and that can cause heart attack. In medical term, we call myocardial infarction. Myo means heart, myo means a muscle, cardial means heart, so it's heart muscle infarction. So another example of the plaque is atheroma, which I actually showed it here. So other words, atheromatous plaque. This is a buildup in the wall of an artery in the arteriosclerosis process. And another example you will hear about plaque in medicine is amyloid plaque. So this is an extracellular deposit of amyloid beta, which is believed to be the culprit of Alzheimer's disease.